Ladies and gentlemen, welcome to the second panel. They are already on stage. Carmen is very efficient as always. It's wonderful. I'm very looking forward now to this one. We already had the first question for blockchain, and that was actually the perfect introduction. So we'll speak about decentralized health data management, one of Carmen's core topics. So please, Carmen, take the floor. I'm very looking forward to this one. And a round of applause for them as well.
Excellent. So can I ask something, please? If you're sitting really in the back, usually at school, what the professors would do with us, if you're really sitting in the last rows, they would ask you to come in front. So could you please, in the last 3 rows, could you come closer so that you see us better? You can ask more questions, and we will be very nice and cozy. Thank you. So while we do that, let me give you some thoughts and clarifications, because we already, you have seen from the previous panel, we already received questions about blockchain and smart contracts and technology and AI. So why are we not talking about technology? We're talking about technology and the back end, let's say, of decentralized healthcare in this panel. The first panel was more, I would call it the front end of healthcare, decentralized healthcare. So we looked at the patient perspective, and it made sense that the patient should not know whether it's a smart contract or a blockchain or an AI federated learning model. They need to know that the data is accurate, they can trust it, their physicians know what to do with it, they are empowered, etc. In this panel, again, we're going to look a little bit at the technical part, because we do have a very interesting set of colleagues from the panel. I will introduce them in a second. I will let them introduce themselves. But before that, it would be good to see who we have in the audience. So if you see yourself representing the healthcare sector, so pharma, research organizations, hospitals, medtech, can you please raise your hand? Healthcare. Who is in healthcare? Very many people. Interesting. Would you say you're more the Web3 people? So blockchain, decentralized. Let's see how many Web3 people. Technology, hardcore, AI. Okay. Good. And you can raise your hand multiple times. Is anyone else that doesn't recognize themselves in the 2 categories? Academia, students, other industries. Okay, good. So I think we're talking to an audience mostly formed of Web3 decentralized tech people, which is good, because that's exactly what we're going to have the expertise today. Very briefly about myself, because I realized I did not introduce myself until now. My background is in digital health. And for the last decade, I used to work, now not so much, within the pharmaceutical industry. So the business side, I've been implementing digital health solutions. We did AI models. We looked at technology, but it was mostly the business side. However, we do have, and I would like to give the floor to each of our panelists, we have a very good blend of expertise in this panel in terms of research, scientific research, entrepreneurship, machine learning, AI, blockchain. So Arash, could we start with you? Yeah, I think we can do this first.
So, hi everyone. I have to turn it on. Yeah. Hi everyone, my name is Arash Rafii. I'm primarily a OBGYN, so a gynecologist. I was mainly in academia for 15 years at Cornell University, where I had my own lab. My practice was around gyn-onc, and I also led the clinical research department there for 2 or 3 years. I did a lot of humanitarian work, not with MSF, but a lot of travels to Haiti and Africa in particular. And a few years ago, I left academia to build an open source platform for scientific publication, which is called SciNFT. And from that, we spin off with one of our scientists who published a lot of his work as open source. We spin off another app called Lena Care, which is an app for women's health.
All right. I guess I can go next. So I'm Charles. I'm a machine learning engineer at Flower Labs, where we develop an open source framework for training AI models in a decentralized way. So I don't have too much of a health background. I'm more on the technical side or the AI side. But I've been involved in quite a few health-related projects. And yeah, I guess that's mainly it.
I'm Eberhard Scheuer. I'm actually a psychologist by training, so I'm not a technician. But I've been kissed by blockchain virus due to Reto, one of the founders of Crypto Value Association almost a decade ago. So Reto, you're here, and because of you, I'm here as well. And we have founded blockchain for healthcare very long ago. Went to a lot of different iterations, and now we are combining AI since a year with blockchain, and I think this is also what you're going to talk about today.
Excellent. So we are going to have 3 themes. So you have seen this theme of 3 repeating. In about 20-25 minutes, we will take your questions, so please start thinking about them. We will look, of course, at the, let's say, because we launched also the report, as we were mentioning in the beginning, we look at, let's say, the life cycle of data management. And of course, when you talk about data, there's no data without AI these days. So you can benchmark it to the life cycle of an AI model as well. So we look at the early phases with data generation. The previous panel covered a little bit the types of data that can be collected by individuals in a decentralized way, but I think we have much more experience or broader case studies here. We will look into federated learning. So we need to see how many in the room know what is federated learning, FL. Okay, so we will, very good, we will explain that. And then at the end, we will look into decentralized governance, DAOs, not DAOs, but basically how do we make sure that kind of at the more mature level of data management, there is some decentralization in the governance, right? And maybe a very quick disclaimer before, when we say decentralized, we don't mean everything needs to be decentralized, right? There is a continuum of centralization to decentralization. There are elements, and we will talk about some of them, where keeping a centralized oversight or even infrastructure makes sense. So we're not coming here and saying the future of healthcare should be completely decentralized. Very important. So if we go to the first round, decentralized data generation, what new health data can we unlock? I think, Eberhard, you touched a little bit on the health intelligence, but not too much. You just mentioned this blockchain and AI. Could you tell us a little bit more about what you're doing with the health intelligence, and especially what type of data are you helping the users to collect that maybe a centralized hospital system wouldn't, and what are the most promising use cases?
Well, maybe we have to go a little bit back what the situation is nowadays in healthcare. We talk a lot about silos. Data sit in silos and are not accessible, and the type of data that sit in the silos, pharma, hospitals. I used to work at the University Hospital in Zurich. This is only a kind of a snapshot of data. Clinical research is also very specialized case. Drugs are given under certain conditions. You measure the outcome, i.e. what the treatment benefits are. But that has nothing to do with real life. So on the other hand, in the first panel, they talked about sensors, wearable devices. That's totally on the other end. But both types of data are equally unusable for the judgment about the patients in everyday life. So because we exist between those special cases, going to the doctor, then after 6 weeks we have another consultation, so the doctor doesn't know what happens in between. The patient knows, if they care about their wearables, something about themselves. And actually the patients would be the only ones who are able to consolidate the data from the different silos. I mean, 2 decades ago, they designed the first idea about the national health record in Switzerland. We all know since a couple of days it will take another 5 years until it eventually will be accessible as a tool to the patient to collect and organize his or her data. And I'm very cautious because I used to consult companies in that field, so for many years, and it's a total mess. And the type of data we help patients or users, I would say not everybody's a patient, sometimes we're patients, sometimes we're just users. I would like to have an overview of what's going on with me. And I'll tell you one reason why we started with AI is because I went to get my flu shot last November, and you know, the vaccination record in Switzerland got hacked a couple of years ago, so there's no digital vaccination record in Switzerland. So I asked the lady at the travel center in Zurich, can you give me a digital certificate of the data? And she said, no, but I can give you paper. So what I did, I was really, of course I knew that's going to happen, and then I wrote a blog post about how I took a photograph, how I sent it to Grok, the Twitter AI, and asked the Grok to give me the FHIR resource for that event. FHIR, for you who don't know, is a data exchange format so that you can actually give those data that I just photographed to legacy systems. And so with that, I really bridged from paper to the digital world, all by myself with tools that exist. Then I wrote this blog post that I never trust the government again, that they will give us appropriate tools, and I got like 53,000 impressions on that. Then the BAG got involved, and then this was it. And then I decided with my team that this is probably a good way of entering AI into the whole game, because what AI does and what we use it for is just summarizing data from different sources, photographs, PDFs, wearables, so that you can get a brief overview over your health, and you can also share that kind of data with whoever you want to, with a doctor, with a nurse, with a dietitian. And you can also enter data or tell the AI agent data about what's going on in everyday life, which you usually don't get.
So everything from wearable data to x-rays.
I hope they're not leaving because I'm talking too long.
Very interesting. So talking about what type of other data or other correlation between, let's say, patient-reported outcomes, if we call them like this. Arash, in LenaCare, when we were meeting, you mentioned that you have collected, I think, data from 3,000 women in 55 countries. Different things, fertility, anxiety, sleep, etc. And you have seen a correlation that maybe has been a little bit missed from the traditional clinical research. Could you tell us a little bit?
The story is really interesting because it started as a kind of a personal question. My daughter needed a contraceptive pill. I give it to her, and she asked me, but how does that impact my fertility? And I'm like, it doesn't. And she's like, but what impacts my fertility? And one of my friends, Michael Greenberg, is one of the best fertility doctors in France. So I called him and I said, do you have a score? How can I answer my daughter? You know, like basically that's not my expertise. And he says, oh, I did a score a few years ago. And he sent me a Word file basically with few parameters. And then we started doing the research and we created like a 50-question website where any woman can just answer questions and know what are her chances to get a baby, or what she should work on, what she should stop, what lifestyle changes. And we really put it online for our patient because it was just easy, and we told them, do it before you come in. And so, instead of me talking to you for 20 minutes, just do it. And it just like went viral, basically. It went like suddenly everywhere, like Indonesia, China, I don't know how. And we realized women love to give you, women love questionnaire, that I have noticed before, But they're really eager to give you data if you genuinely give them something in return, and we don't ask for subscription, and we will never ask for any subscription, so that's for an answer to the panel before. And we also realize that we're very European-centric. You know, we're here talking blockchain, NFT. I travel the world, and I've seen women in Africa. They never will care about these things. And so I think one of the major things is if we want to get better at medicine, we're way beyond clinical trials. We need millions of women answering questions, millions of men and women. I'm just more interested in women, but millions of them answering questions to find correlation. And for us, for example, we found this very high correlation between anxiety, poor sleep, and lower fertility. And then the biology of it also makes sense. It's higher cortisol and adrenaline that impacts other hormones. So then we reached out to this woman and we told them, like, listen, like, a bunch of you have that, like, correlation or in this, like, Venn diagram kind of thingy, and this is something we advise. And then the woman told us basically, can we have more content? Can we have yoga classes that we can do online? Because, like, everybody is not in, like, San Francisco and cannot go to a yoga class. No, but some women have never done, like, the most women that are the fabric of society, so nurses, teachers, they don't have access to this, like, I would say, like, bobo kind of bohemian or, like, higher class thing, and we never think about them. I see them in the clinic every day, you know, and then they have no clue what meditation is, yoga is, you know, they have never seen a therapist, they never think about it. And so that's how we came to create the app, which now going to have 8 to 10 questions about everything: sexual life, personality, and a lot of things I learned about myself when I do the questionnaire to test them. I'm like, oh, I didn't know that about myself. That's cool. And so I think that the problem is that incentive is a problem. And the incentive right now is to sell you a new drug or get somebody in a university to get his next, like, professor appointment. That are the two main incentives of every clinical trial, you know, and I've been there, I've done that, and so it's never patient-centric. It's never patient-centric. And one of the things that I'm part of many scientific societies, where are the patients? Where are the women and the men that we are treating as physicians? Then, you know, that dogma that every conference is, like, pharma-sponsored, so the people in the civil society cannot be in contact with them is horrible. Like, you never talk to the patient, so you never know what they want actually for their life. And, you know, so I think the next phase is basically offering, and somebody said something super interesting in the previous panel, is that all the EMR systems are horrible and it's not transferable. Today, it's very easy to give patients an app. So you said, like, you know, Switzerland is going to take 5 years to create a digital vaccination. Or, yeah. I mean, give me a tenth of a budget and I build you an app where every patient can have all their data and they can add doctors to their profile, exactly like you have a Instagram file, a picture, and you have friends, you know, and that can be a private space. So I think we're going into that era. I also think that it's a little bit, and we kind of failed with that with our previous project on that topic. People are not educated on blockchain and NFT. It makes, you know, everybody scared. Like, it was so much thing on the media of, like, oh, you know, crypto is used for drug trafficking or whatever. So I think that's another layer. That's a little bit later. Right now, we just have to get people to have, like, all their medical data with them.
Yeah. Oh, that's we know nothing happens very, very, very quickly in healthcare, and yeah. But I think what Eberhard is also doing, just digitizing, you know, the existing data, finding correlations for primary and secondary kind of views of data. That's amazing. Federated learning is coming next, and we will come back to also, you know, how patients or individuals can contribute with their data in a privacy-preserving manner in these federated learning approaches. But first of all, Charles, you have seen the result of the audience, so please explain us, how can an AI model train on data sets without moving the data in a central repository? And maybe you can take an example of a hospital from Geneva, HUG, that wants to contribute research with another hospital in US and one in Ghana. How do they do this?
Absolutely. So I think, first of all, it's important to consider the fact that most data we generate is distributed naturally. So it's not all in a centralized server. And the classical ML approach, so even if we have medical centers in different parts of the world, the classical machine learning paradigm would be to send all of this data to a central location, so to a central server, where we have all the compute, and we would actually do the training there. And so this is bad for both user, or in this case, patient privacy, and also just regulations, because most of the hospitals cannot just share data across borders. And so federated learning is actually pretty simple in conceptually. It just shifts this, actually reverses this paradigm. And instead of moving the data to the computation, we move the computation to the data. So instead of sending data to a central server, each hospital is going to train locally on their own data without moving it, and only send the results of the computation to a server. So this computation for training a model might be complex, but we can maybe take a very simple example. Say that you have all those hospitals and you want to compute the average age of patients there. So the classical ML paradigm would be to send all of the data about patient ages. So you would just send a list of patients and their ages. And instead, with federated learning, you would, for each hospital, you would compute the average and then only send the average in the end. And so with all the hospitals sending their average, you can get the exact same result as the case where you have sent all the ages to a central server. And so this is the rough idea of federated learning. And yeah, just one thing I wanted to add is that here we are in a case where we have a few hospitals, but this also applies where with cases where we have wearables generating data from thousands or millions of users.
Exactly, because we're going to get to local AI and how individuals can also contribute data without letting the data leave. But before that, Charles, can you share with us, I was researching a bit the Flower AI partnership with Blood Counts Consortium, which I think is the largest in the world in terms of, at least for the kind of the blood research on rare diseases in terms of federated learning. Could you tell us a bit about this?
Absolutely. So this is actually very interesting because this project focuses on actually blood tests, which is, I believe, the most widely done test in the healthcare space. It's near billions of tests done every year. And so this is worldwide, and so this is a perfect use case for federated learning because we have all of this data that's already being generated, and the good thing also is that it's mostly already standardized. And so Blood Counts, which is a consortium of different research centers and hospitals, so they did all the networking work to get all those different centers aboard. And then Flower, we provided the software and the infrastructure to actually allow this training on all the data that was already being collected. And so I think this is a very interesting example of why federated learning can be very useful in this space, because first of all, this is something that could not be done with central AI. As mentioned before, you cannot just share patient records with different organizations. And also another very interesting technical detail is that in this case of blood tests, you can have results that are very specific to different demographics. So for instance, you could have a bias of some populations that have lower iron levels, for instance. And so if you only use your local data to train models, you would have models with a huge bias. And federated learning allows us to generalize better on, because you're essentially improving your model with a bunch of other data that's distributed in a different way.
Yeah, so I see already the cross-board, but also this, as you say, the richness and the representativity of the data sets, but then is also the legal and the ethical thing of, are you going to share my very, very sensitive PII too? So very interesting from a hospital perspective. Eberhard, maybe could you comment a little bit? You mentioned with the health intelligence, you transform the data into FHIR standards, so it's interoperable, yet you are not managing the data, or you're not holding the data on behalf of the patient. Is there something about the infrastructure that you build, and we had the question about smart contracts, where such a decentralized system could be used by patients to share data for research, but in a privacy-preserving manner?
Well, there are a couple of approaches to tackle that challenge. First of all, yes, we are very data averse. So we don't want to hold any data. We don't want to be the custodian of data, because data ownership comes with a lot of regulatory burden. So the way we organize it is, right now the models are still too large to run on local devices. So we rely on the usual suspects, Amazon and Google Cloud, and they're very expensive actually if you run your own model there. But the patient or the user, they organize the data in a folder. It can be local, can be on a distributed storage system, can even be on Google Drive if they want. So they give access, temporary access to their data to the agent, and the insights that are generated are returned to the user, and there is no cache data staying on the server. But this is the way it works right now, and it's a little bit, the application comes to the data then the other way around. There are certain cryptographic methods that you can apply. Something is zero knowledge proof, that you can ask the data, okay, is that the case? But you get an answer, but you never have access to the raw data. Then the other way is fully homomorphic encryption, that you can do analysis on encrypted data, so nobody really can copy your data. In the case of genomic data, this is really important. My co-founder, she does that in a project that might be interesting to you, Genorare, in the Netherlands. So this is how we do it right now. We don't touch any data. And we see the future in such a way that the AI will be more optimized, so the devices will be much more powerful. We already see that with iPhone 17, which is prone to run Apple intelligence on the device, and that's the strategy of them. So we see that more and more, so that the AI will run on the devices, so you don't even have to transfer the data in the future. So you are the master and the gatekeeper to your data, and you share whatever you want with whom you want. You don't have to care about regulations because it's your data in most countries. And then if you talk about devices and the memory that you build up about yourself and the health, might be in the future, what we see in China is they produce a lot of robots. What are they going to do with the robots? So maybe those are and they don't have doctors. Not enough doctors, and they treat it very badly. So some of them get killed because the outcome of the treatment is not what the family expected. So make a long story short, we see that in the future we might have those robots running healthcare agents with your history of the treatment for many years, and so they can actually be the care for you at home, and you don't have to go to the nursing home. So this is looking very much into the future. But given the speed of the Swiss patient record, they might be earlier reality than the Swiss Gesundheitsdossier. Yeah.
Thank you. Okay, so I think the person that asked the question about the role of smart contracts is not here.
Yeah, but I answered that
in the break. Excellent. So Arash, I think to close the federated learning, and I think we will go to the questions next, you have, as you said, you have done a lot of traditional kind of clinical research, but you've also done side NFT with a lot of patient-driven and patient-led initiatives for research. Could you share a little bit, you know, from your old life, what do you think are the barriers for the healthcare system to adopt and implement federated learning, but also from your new reality, where can patient-led research
So from the old life is really limitation now. Most of the studies in the, let's say 2000, you know, the major studies like 100,000 women, like on menopause, for example, or like menopause treatment in cancer. In cardiology, they have cohorts of like 100,000 to 150,000. You know, some genome project now have 200,000 like data set, data points in the Middle East, or I think Estonia is sequencing everybody. But you can't follow that number of people. There's no hospital that I know in the world, and I've been to like most of them, they don't have the ability to follow 100,000 women on a long time period and time scale that would be relevant to, you know, health. As we said, you know, health is, my patient interactions are 15 minutes, but what destroys them or helps them is like a daily thing. So I realized that limitation, and so one of our ideas when we created SciNFT is like, any data point, so if I do a clinical trial, and I'm a diabetes, because at that time I was a little bit obsessed by data consistency and robustness, my patient get an NFT file that encodes all her data, and then any doctor or any individual, any citizen can have a query. It says, I want to know how many patients under that treatment had like that like side effect. And then the patient would then contribute, and the NFT would encode the consent form. That was my first idea, and that would be smart. You know, you receive an email, you were in a trial, another doctor, even unrelated to you, maybe in China, has a question. Do you agree to share, you know, your data? And that and then I realized all of this is also BS. Patients don't really. Privacy is very overrated. It was created like it's a legal system. I put my own genome on LinkedIn. Nobody downloaded it. I put a link to my genome. I say like,
that is recorded.
Please, who cares? Please do and get back to me. Because like honestly, like I was at some point, what is this privacy thing? So I'm just gonna put my genome that everybody is scared to share, and like if you find something, just get back to me. Nobody really downloaded mine, so it's okay. I had to do the work myself. But I take a very simple example. Take a question like, did COVID vaccination impacted women's periods? And a lot of women in the clinic tell us that, and they've seen so many other doctors that say, no, I don't think so, or it's, you know, it's coincidence. You just can't study this in a regular study manner. But if you have millions of women reporting that side effect through any portal, you know, any portal, make it like an app for like women that have weird periods, you know, make it, then you start getting federated learning, you know, and then this guy can tap into it, the Swiss system can tap into it, et cetera, et cetera. And I think that the future for me is educate people, empower people, give them power back on health, and they decide what they want to share, you know, what they want to share, like a name, what's your identifier is your name, but you know, you can have an email for that. I mean, there's a lot of way to anonymize data if that's important, but I really think the whole, the problem is not a patient. Any of you in the room can send me a file. I've been like, people send me files of their like friends all day long. I'm not the problem. The problem is if like the workplace discriminate against you, etc. And you can protect people from that, but right now it's preventing researchers to even access data, you know.
Very interesting. Okay, so we have some challenging thoughts here. You know what? Because it's 10 minutes before our networking apéro, we will skip the third round of discussions about decentralized governance. You might have questions about decentralized governance, but we do want to open up the floor to you right now for questions. And I'm gonna move from my beautiful chair. Oh, yes.
I'm too curious about everything. That's why I always have a question. So there are a couple of different aspects that have been covered. So I'll try to formulate my question in a clever way. I might agree on the statement that sometimes privacy is overrated. And so we tend to make it more complicated than it could be, or we create a problem where it's not there. However, at the moment, we have two categories in the world. We have the people that might be more liberal from this point of view, like me. I'm okay in sharing this data with less restriction. But we also have other people that want to care about where their data are, and then they want to have a local AI that will support the training of the data on site. In the opinion of the panelists, how do we conjugate those two words? This might actually go in the direction of a form of decentralized approach in sharing those data and making them free or private. How do you see a possible solution, maybe 20 years ahead? I don't know. How much do we need to teach to the Swiss government or to the people? Which direction do we need to take?
I can start. I agree with you. Some people don't want to share, but I don't know if they don't want to share because we've told them it's not good to share, you know. And I also understand privacy is very important for people that are buying drug on Telegram. So I get that like concept of like, you know, like privacy can protect you from whatever. I fully get that. I just think that most actors are benevolent. Most actors, most people that want to do research. So for the risk of a 0.1% or whatever, 0.01% of people that might want to harm you, we kind of depriving 99.9% of people. And also, I'm not sure how much privacy is going to hold. Like, they hack everything. They hack the Epstein file. So, I mean, like, who cannot hack any hospital? There's no hospital system that has a robust, you know, I mean, you guys are probably better, but I don't think the Swiss hospital, the French hospital can defend themselves against an attack of China or Russia. There's no way they're going to defend themselves. So it's a lot of effort for something that's not really worth it. And then, you know, you don't want to share, you don't share. Like, you know, I share my location with 10 friends. It helped me so many times find my phone that I lost in cities. You know, there's limit also to privacy. So I'm not saying, I'm not against privacy. I'm saying at some point it just like that narrative completely, everybody's scared of sharing.
Yeah, I mean, it's interesting because I see what you mean, but I also think that it's, we actually have many existing tools that we can put together to ensure some level of privacy. And especially in the beginning, I think it's pretty important to build that trust with the patients. One thing you mentioned, and I think it's also quite important, is to have this be opt-in, at least at the beginning, so people don't discover that their data is actually already being used for things they're not aware about. But it's an interesting perspective to, I agree that in many cases, for instance, I mean, in federated learning, there are all those papers coming out trying to kind of break the system, those adversarial approaches that are very sophisticated. They're not realistic in terms of what it would mean to do in practice. But still, we build tools to mitigate them. And so I think today we could already build pretty strong system to ensure the privacy of users, kind of build that trust. And because I think for all of those methods to work, so for AI to really have an impact, we need quite a large adoption. And so I think it's a balance between the complexity and the trust that we're able to build with patients. So yeah, I think it's kind of a trade-off that we need to balance.
I mean, there are probably other questions, but maybe let me touch on that briefly. It's important that you have a choice. can it be private? I don't care about privacy. Sometimes you don't care, then a couple of years later you care and you have no chance of turning back the time. So in good old times, when you entered the hospital, you gave a universal consent of using your data for research forever. Nowadays, some countries force you to have a case-by-case consent of accessing the data, but how on earth will you do that as a hospital? And this is, I mean, we're at Crypto Valley, so we should talk about blockchain. So first of all, if data is decentralized, you don't create honeypots. So hackers care about big hospital data, and they don't care about the data, they just care about the ransom that they get that you can access your data again. So, but if they have to hack 5 million wallets, then good luck. And so with blockchain, you have some traceability and you can actually track when data is being created. There's a company in the US, in Boston, Circular Protocol. They do exactly that. They just take a snapshot when data is being created, and you can actually go back to that hash that created, or that address that created the data, to ask them, is it okay to use that data for that purpose? And this is actually where blockchain can come into place. Smart contracts, you can use it for insurance cases. If you fulfill condition X, you get a payout of 90% or only 60%. So, but it's very important that blockchain and decentralization gives you a choice, and you can be reached in the system.
And I think the last piece of the puzzle, so you have privacy preserving technologies, we discussed about those. We looked at the smart contracts and giving individuals a choice of opting in, opting out. And then I think the higher level we didn't discuss too much is decentralized governance. So the DAO type of initiatives where individuals can opt in at that population level in a way, so at the community level, to decide what is important. Why do I want to give my data? For cancer research, okay. Are we all in agreement that this is important? And then I think the individual choice becomes a little bit easier if we slowly learn from other industries how to do decentralized governance. And DAOs, again, we didn't have time to discuss, but I think it's super interesting. Would you like to close with one or two words and hopes from your side? So if you think 2030 comes and healthcare is a little bit more decentralized, maybe not fully decentralized, what is your hope for 2030, or what can be achieved?
I hope the Switzerland will figure out their vaccination. That's a hope for you guys. I'm not really concerned, but no, I really hope that we can prove that. I mean, with what we created on the app, I hope that we're going to be able to prove that millions of women can build a community of smart researchers, and they can come up with their own question. Questions are always asked by us as doctors, but women have a lot of questions that we never think about. And so I hope not only to see patients sharing data, but women, right now most of influential health, I would think are on Instagram and TikTok, and they're not doctors. They're normal people that put posts. They're followed by millions of women. There's no doctor followed by millions of women in the world. So I hope that we'll see in 2030 women asking a question and having a million data set or platform that help them answer that question without any healthcare provider being even involved in that. That would be, and that we also destroy the scientific publishing system, which is only paywalls, and completely not accessible to the general public. You take a cancer treatment, you never have a lay summary that somebody who might have that cancer can read and understand. So that's my hope, and with AI, I think it's going to be very, very feasible.
Go ahead, Ross.
Right, so on my side, I think it was actually mentioned during the previous panel as well, this idea of a human-centric approach. And I think it's really important, especially now that we have all this hype around AI and all those crazy projects around it. I think it's important that we not only focus on this human-centric approach and also try to shift the incentives from profits to the actual needs of the patients. And I think this is also one thing that can be done with decentralized AI. And I just wanted to touch on some example, because also the previous discussion reminded me of this. At Flower, we've been working with a collective or a foundation, which is called the VANA Foundation. I don't know if some of you are familiar with them. And essentially what they noticed is that there are all those companies that gather data on users, and users have absolutely no power on this or no ownership. And their goal was to kind of flip this, and instead of those companies taking their data, they could actually download the data that was being collected on them and do useful things with those and benefit from them. And I think this resonates with what was discussed as well as giving the patients some benefits from the data that they're willing to use to participate in different initiatives.
So great, I have the final saying now today. Never managed to get that at home. So in 5 years from now, I still hope that I don't have to care so much about my health data, because I hope I'm still healthy. But nevertheless, I think that I can carry my data. I have a copy of my data at least. So I can talk to my data, and my data can talk to me. Eberhard, you should take your next flu shot, even if it's on paper, just get over it. And so that I can talk to my data, and the AI using my data can talk to me and guiding me to a healthy life.
Everything goes back to us and the flu shot, yes. Thank you very much. We're 5 minutes over time. I will probably, Stephanie, do you want to do the closing? Okay, because in reality, we are almost done. We have an apéro. I know some of you have to go back to Zurich, so thank you very much for attending. Very few things. The report is still available if you haven't taken a look at it. Of course, follow us on the organizations, because we're all not-for-profit organizations, and a community is very important. CVC Crypto Valley Conference is next year, so it's a very, very interesting conference. Web3, there will be healthcare-related topic, but of course not so much. MSF has a beautiful Instagram. If you guys use Instagram, there are beautiful stories of care with what their doctors are doing in crisis situations on the ground. And yes, Olga is still here, so if you want to grab her to understand what you can do in the Western chapter of CVA, please do so. On that note, thank you very much to our amazing panel. Round of applause. And I've been told I should sit here so that we also get the recording, and you will see the recording soon on the CVA and MSF, I think, channels. So if you want to share it with someone or to just refresh your memory, do that. And please join us. Mario, we are going to have some apéro. Just follow Mario. Mario is here. And thank you again very much for hosting us, Mario and MSF. Thank you, everyone, for joining. Thank you.